We normally converge once in a year for a scientific conference, and that is what we came to do in Sun and Sun. And we come here to impact knowledge in our people so that they are able to do the right thing. You know, the medical practice is dynamic and things keep on changing. So we come to update ourselves every year, and that is what we have come to do. What I can say about the counties in terms of our employment is still low. I would say it is not right for a level 3, level 4, level 5 hospital to only have 2 or 3 orthopedic and trauma technologies. Because even attending to one person, you need at least 2 or 3. And then this is a service that we give on 24-hour basis. So you cannot have one person working for 24 hours. So I would encourage our employers now, most of them are the county government, please consider the employment of orthopedic trauma professionals.
Having been elected as a new president, I anticipate to forge more alliances and better the skills and capabilities of our members. One is through the KHPOA, as our CEO is here. He is well articulated, and we wish to forge and merge our ideas together, at the same time empower our colleagues out there in the field. Secondly, I wish to see more empowerment of my professional colleagues as pertaining to training. We wish to expand even regionally, like we have our guests from the diaspora, Uganda. We also intend to spread more to these other neighboring countries. And through this merger, even my colleagues who have been trained locally, they can also seek employment and be recognized in these other countries. So we have much more to put across to all of us. At the moment, we have about 1,500 members who are employed. But we have so many who are yet to be employed. We are still seeking. And as my outgoing president has said, we urge the counties and other employers to open doors so that we have professionals working at the right place and in all the health centers across, from counties to the lowest level.
Today, I'm deeply honored to officiate the scientific conference for the orthopedic trauma technologists in the country. A very key and central professional cadres in the practice of medicine and the management of patients in the country. The task with rehabilitative services for trauma patients. But today I had conversations with the participants on the need to standardize the training of health professionals in this country, especially in the backdrop of what we have noted in regards to mushrooming of training institutions in this country, training health professionals of different cadres who may not be needed and in this country. And therefore we have taken it as a responsibility, working with other government agencies like TVET Authority and TVET CDAC to make sure that we work together to contain the coming up of institutions who will be training health professionals in this country. So it's not just about the KHPOA, but also working together with other government agencies to make sure that whenever a training institution for health professional is coming up, there is going to be a rigorous consultation and an agreement that this training institution is compliant with the set norms and standards. But again, also to insist that all health professionals that are working in this country, or anybody who will be entrusted to manage a patient, will be required to have a practice license for you to be allowed to see or to touch a patient. A number of people have presented themselves as qualified health professionals, and yet they are not. They do not have the requisite requirements to practice, and therefore the need for us to make sure that you are vetted and you are registered and licensed to practice in this country. It will be a requirement, and as an authority we call upon all the employers, including the county public service boards, to make sure that all professionals who are being recruited, who are being employed in their institutions have two documents. One is registration from a recognized professional body, and also a license from a health professional regulator. Those are two documents that will be needed to ensure that the people who are going to be employed in institutions, whether government or private, are qualified and are allowed to be able to see the patients. Thank you. The standards of training are not in all training institutions. Of course, there are those training institutions that upheld the standards, but there are those who have gone to the extent of not complying with the standards, where you are admitting more students than you are supposed to do, or where you do not have the necessary faculty or the teachers. The numbers is not matching with the number of students, and therefore this compromises standards and the products that you're going to produce. As far as the number of training institutions we have very many institutions for training health professionals in this country. I can't remember the number, but it's well over 500. There are very many of them. For us, we have been able to inspect 350. But I can tell you that out of the 350, 25% of them are actually non-compliant to norms and standards. And that's why I'm saying we are going to work very closely with the other government agencies to make sure that if you don't comply with the norms and standards, you remain closed until you comply, because most of them may not even have infrastructures that are necessary. You go and find the classrooms are so hot, they have poor ventilations, even the floor is coming out. I mean, they don't look like classes for training health professionals.